Welcome to Trauma, Psychedelics, and Buddhism with Karen Sprinkle, certified psychedelic guide, trauma therapist, and author of The Thriving Self. Drawing from over 30 years of experience in trauma therapy, embodied Buddhist practice, and immersive Eastern living, Karen explores the many paths to healing through conversation with Dharma teachers, scientists, and mental health professionals. Listen in and discover new ways of thinking about what it means to truly heal and to thrive.
Hi, everyone. This is Karen Sprinkle from Trauma, Psychedelics, and Buddhism. And I'm very excited to have with me today my dear friend and colleague, Tom Faupl, who is an integrative and somatic psychotherapist in private practice in San Francisco. He frequently works with developmental trauma and is trained in EMDR, brain spotting, somatic experiencing, and internal family systems. In 2022, Tom participated in a UCSF Psilocybin clinical trial. Tom, I'm so happy you're here today. And I want to start off by saying you've done a lot of training. Wow.
Yeah, Karen, it's so nice to be with you. And some of the training we've shared together. And I'm really excited about our conversation today.
Very, very good. And I will say, as a clinician that's trained in all of these things, it takes a lot of years and a lot of dedication.
Yes.
Your
I totally
clients
agree.
are very, very lucky to have you, Tom.
And thank you. I appreciate it. It's a lifelong journey for us all.
Yes, indeed. Indeed.
Yeah.
That's why you're a good clinician, because you know it's a lifelong journey, in my opinion.
Okay. Well, there's always new challenges, new depths that we find, and it's even on the subject of psychedelic work, it just really does. My experience was it really took me to levels that I couldn't have, I don't think, gotten to through more traditional approaches in therapy, even trauma approaches.
This is exactly why I wanted to interview today. So thank you, Tom, for agreeing to be here. And that helps us move into our first question, which is, I would love if you feel comfortable sharing what brought you to be a participant in a clinical trial for psilocybin. What was the process of that?
Yeah. So in 2017, I received a preliminary diagnosis of Parkinson's, early Parkinson's. And I had another diagnosis that was not so sure about it. So over the next 5 years, my symptoms were pretty much the same. I was not on medication. And then COVID happened. And then in 2022, I started experiencing maybe some more symptoms and that were concerning. I was thinking of going on medication. It was a pretty big issue for me, and I was working full time and living my life fully still, and also the issue of psychedelic research and psychedelic therapy was becoming more and more prominent. Something I looked at, that I wanted to get trained in that. It seemed like I should be, I had some interest in experiencing it directly, and there was a question about how to go about that. So, I looked at some providers that were not therapists, but we were communicating via signal, and it was just a little bit on the down low, and I wasn't sure how I felt about it. And then I found this clinical study at UCSF for psychedelic therapy for anxiety and depression. So I made a contact with them, and as I got to know the people involved, I decided to go ahead with that. And one of the things that attracted me to it, UCSF is a prestigious institution, so I felt like, the quality of care would be excellent, and the quality of care was excellent. I had a therapist and a doctor sitting with me during the two sessions. We had uh, pre and post therapy sessions. I met with the lead psychiatrist of the study. So the surround care was excellent with that. I came to psychedelic, this project, with no previous recreational psychedelic experience, no previous therapeutic psychedelic work. So I was basically a newbie,
Uh-huh.
and I jumped right in, and I I learned a lot from that. In terms of, if I were to do it again, I'm not sure if I would start with a clinical trial, because it has some pros and cons to it. And um, so uh, I think, if in retrospect, for me, maybe working with somebody, um, and it's not really set up to do it this way yet, but working with somebody privately over time may have been a better decision for me. And I would say that, for people who are highly sensitive or empathic, or
Mhm.
that you want to really set up the circumstances and the groundwork for that. So, because for me, the clinical trial was, it's my understanding, and you can correct me if you know more about this than I do, that maybe the hero's dose is about 5 grams or milligrams.
Yeah, that's my understanding, about 5 grams.
5 grams. And I did 2 doses, one of 10 grams and one of 25 grams. So that was significantly more. So my first experience was 10 grams. So
Wow.
that packs a punch.
Oh my goodness, I'd say so. Yes.
And then, we did have discussions about, I did have some concerns about the um, dosing being so high and how I might do with that. And it was challenging for me. It was a powerful experience, very, very intense, dark at times, felt a little traumatic at times. Um, I was just reading my notes this morning. Uh, One of the people who sat with me took notes of the content that came up. And there were some real kind of beautiful moments that came up as well. But it just physiologically was very stimulating to me.
Hmm.
And it took a while to kind of re-regulate myself after that. And I did stay over at Langley Porter at the end of each night. And gosh, I could feel my brain racing. And so I had some questions about the dose and what it does to the brain, um, and whether that's, how much is too much for the brain, and things like that. Um, so let's see. That was uh, probably one of the most challenging parts, was the intensity.
Yeah.
So in the first dosing, the soundtrack, I listened to a soundtrack. The soundtrack was beautiful.
Hmm.
And the second dosing at 25 milligrams, I could not put on the eye patch. I was just in the room, um, because it was just such an intense experience.
Mhm.
And the experience, since I had no idea what to expect, it took me to a lot of different places. It took me into the future around climate change and all my fears and anxieties for what was going to happen in the future. It took me into past lives. and things that happened in past lives that were traumatic, and took me into kind of my past experiences as a Buddhist practitioner. It was hard to sort out what to make out of that, and it also brought up kind of my experience in my family growing up, my own developmental history, and the ways that I felt I was not fully loved or seen or held as a child, in the context of kind of the intergenerational trauma in both sides of my family, my mother and my father's side. So, it took me to a lot of different places. And also, it was a very somatic experience. I remember my right side of my body was coiled up, and there was a split between a very clear split between the left and right side of my body. So a lot of very intense material came up, and I would say it opened up material that I don't think I could have ever accessed through even traditional trauma work, which is highly effective.
Sure.
It just kind of really opened up another plane inside of myself.
Wow, Tom, I have so many questions for you. And one is actually a logistical question, which is, by any chance, do you know what kind of mushrooms they gave you? Because that does make a difference, whether it was synthetic mushrooms, were they organic mushrooms?
Uh, it was a pill, and it was a pill prepared by I think it was a nonprofit foundation. I could be mistaken, in Wisconsin. Um,
Oh, yeah.
so I forgot the name of that.
Sona Institute out of Madison, Wisconsin.
It was near Madison. Yeah.
Yeah, it's likely Usono Institute that is the front runner of like psilocybin research.
Right.
Yeah. Okay, that's helpful to know.
Yeah.
Yeah.
So it was a pill, and we walked down to the, where they dispense medication in the hospital, and I got the pill. We walked back, and that's how it went.
And what was kind of like the room like? Did it feel like a hospital setting or was it more warm and welcoming?
Well, it was right before the UCSF moved their whole um, uh, department to their new building. So it was, yeah, it was nice. I
Right.
mean, they tried to make it warm and cozy, and I felt very comfortable there. Yeah.
Beautiful, beautiful. So it's interesting for me as a psychedelic assisted therapist now in the world to hear, this is why I wanted to interview you, because to hear from you, who is very, very experienced as a trauma specialist and a trauma clinician and have done years of work and years of being a Buddhist practitioner. Granted, you hadn't had any previous psychedelic experience, but to hear how challenging this was for you. And I'm curious now in retrospect, because when I talked to you about this originally,
Mhm.
you described it as really terrorizing and, you were still in a traumatic experience of it
Mhm.
when you thought
Right.
of it.
Right.
But now has it been about 2 years? Is that right? Two and a half?
Well, I did the trial in 22, so it's going on 3 years now. Three
Okay.
years. It's over 3 years. I think April of 2022.
So has the context of how you hold the experience and the meaning of how you hold the experience, has it changed over the past 3 years, or does it feel relatively the same as when you first finished the journeys?
Uh, I think it has changed. I was just reading some of the notes from the content of what came up. And I mean, there were some uh, openings in terms of um, meaning and purpose in my life, and being committed to wanting to help other people. Um, um, and and my purpose as on the planet as a therapist and a healer. So that I think was really, really powerful. I think that it has taken me to look at my developmental history in another layer that has been deeper, that I think long term has been positive. But it was, psilocybin is kind of tough love, at least it was for me.
Yes.
And it doesn't hold any hostages. So it really made me look at things. And well, not so much look at things, because I knew things from just my years of personal work on myself, but it really put me in feeling them at a very direct, powerful way without my defenses being there.
Mm-hmm.
So that was it was like sitting in a fire. Um, that was intense. So I think about um, dosing. So that dosing, well, it's a clinical trial. So you're
Yeah.
being fit into what they're trying to do. Um, I think for people with complex trauma or with sensitive constitutions, um, that you really have to be careful about what level of dose you're going to bring them in and what kind of support they're going to get um, long term around that, because it can be really challenging. And yes, you can have very powerful openings and spiritual experiences with it, but it does have the danger of destabilizing.
Yeah.
And I think one of the things that I think was the most problematical for me is at the end of it, um, um, it was really confronting me with my relationship to the Parkinson's. And, I was just going on medication, and it brought up a lot of anxiety, and in a way that I've never experienced anxiety before, and sleep disruption. And I think that was the piece that it got awkward because it happened at the end. And so the clinical trial was coming to an end, and there's only so much support. And that set off kind of like, what's going on here? There seemed to be a fear of death, a fear of illness, a lot of deep things, and also a lot of physiological arousal that was I it's I had to do additional work on my own with I wasn't already in therapy. I
Mm-hmm.
had to do follow-up work with that. So that uh, took me to a difficult place.
Yeah, Tom, just hearing you speak, my thought is I wonder what it would be like for someone that didn't have all of the foundational work that you have. Because you've worked on yourself for years and years and years and provide this healing work for others. So, what did you do with your therapist? Like, how did you work on integrating these experiences? Because the conversation we're having right now is very different than a year ago, even when you were
Right.
so really in kind of a traumatized state, it seemed like.
Right.
Yeah.
Yeah. Well, you work with what's up, with what's present. So, I did brain spotting on it. I did some EMDR on it. Worked with a Buddhist healer who worked with my subtle body. And just on the issue of subtle body, I'm a Buddhist practitioner. So there is this kind of other body beyond the physical body that felt like it was ripped open
Wow.
by the psychedelic. Now, was that just related to me? Is it related to anyone who's uh, got a deep spiritual tradition practice? I don't know,
Mhm.
but that had to be repaired. like that was really blown open. So, are some people really, it raises the question, am I really somebody who would benefit from psychedelic therapy? Is another person with another constitution more suited for psychedelic therapy? I don't know, but I just jumped in naively into this, and I found out that this was it was a pretty rough experience for me.
Yeah, indeed, indeed. Well, I think what's really important is that the larger population, now that psychedelics are becoming more mainstream again, is just informed of these things, right? Like it can
Right,
be challenging, it could have an adverse effect, it can be terrorizing, and it can also be profoundly beautiful and life shifting all at the
right,
same time, right?
right,
And to make sure that you have your people, your support system built in above and beyond just the psychedelic assisted therapist. And it sounds like that's what you had to do. You had to return to your support people. You're a therapist, you're a Buddhist practitioner, or you're Buddhist.
right.
Was it a Lama you worked with, or?
The Buddhist healer was a Buddhist practitioner, but I did talk to my teacher about my experience, Tibetan Buddhist teacher about it, and he didn't give me a lot of feedback, but he was just said kind of wow when I explored what past memories came up around my Buddhist history.
Mhm.
And so, I didn't get a lot of affirmation or um, uh, challenge about that. He heard me out.
Mhm. So, as a Buddhist practitioner, because you already had that foundation,
Right.
did that help you with the recognition of just subtle body versus form body or physical body? Because the average audience doesn't even know that distinction, right? So you
Right.
already going into this pilot study understood what subtle body is and was. Is that correct?
Right. But I didn't think about it going into the study because I just didn't um, know that was going to come up. But I think that, if you do a lot of meditation, and you really access the ground of being and the various boundless states, uh, you're 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 really kind of connecting with that body in yourself, and so um, um, it just raises an interesting question about the different levels of impact psychedelics can have on a kind of a more very nuanced level.
Yes. And I'm wondering, with your experience as a trauma therapist and giving trauma treatments, if that was one of the defining differentiations between clinical trauma treatments versus psychedelic assisted therapies, is that subtle body distinction? Or is that too binary to think of it that way?
Well, I don't know. It's an interesting. Maybe it's something for people in the psychedelic community and to explore. Like, what is the impact? Is everyone in agreement there is a subtle body, or there needs to be a discussion about that
Yeah.
and how people experience that? And but it raises a question for me, like if I were to do another psychedelic journey, what could be the impact on me? And
Mhm.
um, um, I don't know the answer to that question.
Yeah. Yeah. What about now? Like, what is your present relationship with your subtle body?
Well, I've gone back to my meditation practice.
Mhm.
So, you know, sitting in the grounded being, it feels, it feels there, and I'm sensitive to it, and it feels in a good place.
That's so beautiful, Tom. I'm so relieved talking to you today versus like a year ago when you described your experience.
Right.
Now that you're in a little bit more of a resource place, I'm wondering if you feel like you could share a little bit about what the traumas were or what they were like during the medicine. If you feel like you can share and speak to that. And if you can't,
Yeah.
it's okay. Yeah.
Well, there were, uh, I had this really weird experience of somebody putting a hex on me in a past life and being murdered in a past life. And uh, I had this whole memory of being some sort of lineage holder and that being taken away from me. And so, it's really hard to understand how do you how do you understand that? Is that some sort of um, kind of it's hard to know what's true about that since I wouldn't say I'm psychic in the sense of I can go back into past lives and experience past lives. That's not been my experience of myself. But a lot of things came up that were very powerful about that. So that was one thing. The second thing was some just present life developmental issues around not feeling really loved or seen by my family, not because they didn't love me, because they had their own trauma. My parents had their own trauma.
Mhm.
And I know my mother lost her first child at age 1 due to he had a heart defect, and I don't think she ever healed from that. I think she held a trauma. And my father was depressed on his side. And there was something that goes back, it went back generations on both sides of my family that felt like um, impacted my childhood
Mhm.
around that. So that was very painful to experience as well. And then I went into the future about climate change and the impact of other uh, what's going to happen to the future children of the world. I got very scared about that, about what we're doing to the planet and the impact on future generations. So it was kind of all over the place.
Mhm. Yeah. And right now, how are you feeling talking about it?
Yeah, it's it's good to talk about it. It's good to revisit it. I was just reading the notes. Um, One of the people that sat with me in the session took notes. So it was good to read that again and
Mhm.
um, see what had come up in terms of the content of the experience. So there was the content of the experience, and then there was the kind of the intensity of the experience on both my brain and my body.
Mhm.
So I don't know if this is true. You probably know more about this than I do. Is psilocybin a more somatic type of experience? For me, it was very somatic. I mean, I felt like somebody had their fist in my heart. Sometimes the right side of my body was just contracting and opening up. It was quite intense. And then there was the impact of the medicine on my, brain functioning.
Mhm.
And I tend to have a fast processing brain, and it sped up my brain.
Mhm.
That's for sure. Now, a dose of 5 grams, what would that have been like versus 10 or 25 grams?
Right. Yeah, totally.
But I think that's what they were in part studying.
Sure. Sure.
What is the safety of that?
How long did the somatic symptoms last for you, the intensity of
Uh,
them?
for most of the session, the somatic experience until the drug um, worked itself out of my system.
Mhm.
The experience in my brain being sped up, that took a couple days. I remember going to sleep that night feeling like I had some racing thoughts.
Wow. So sped up your brain, and it sounds like not a comfortable way. It wasn't like you were thinking faster. It actually was more.
No, it was,
Yeah.
it was felt like there was more of a kind of, wasn't exactly a hyper arousal, but it was like my brain felt like it was like supercharged in a
Hmm.
way that was uncomfortable for me. I think it took a while to get to sleep, actually.
I would imagine. Yeah.
Right.
So now when you think back on it, what would you say the healing aspect of the experience was for you? Overall, contextually, the healing that you got from it.
Well, I think it helped me face some of my denial around, do I have Parkinson's? Do I not? Um, I think it helped me face that more directly.
Mm-hmm.
Um, I think it was another level of personal work on myself around my family history and the intergenerational trauma
Mm-hmm.
on that, and it just reaffirmed my Buddhist practice as being important and meaningful in my life, and something that I want to continue, as well as my work as a therapist.
That is so beautiful, Tom. That's
Yeah.
really beautiful. Would you ever do psychedelic medicine journey again?
Uh, I struggle with that. Possibly under the right, different circumstances. I wouldn't do a clinical trial again,
Hmm.
because I think, there's some real pros to it. There's some really wonderful people involved. I have no complaints about the people involved at UCSF. They were wonderful. They were highly competent. They gave a lot of support. But I think, it's, for me, maybe doing it more uh, in nature or something under different circumstances would probably be a better fit for me.
Yeah.
And um, so, yeah.
And as a Tibetan Buddhist practitioner, I mean, obviously you were part of a pilot study, but what is your understanding for yourself and for other lay practitioners about being a Buddhist and trying a psychedelic assisted medicine for psychospiritual development or for healing?
Well, I think those two can work fine
Mm.
together. I think a lot of Buddhist practitioners have, or the ones that I know of, have experience with psychedelics. So it's a journey of consciousness. It's a journey of healing. It's a journey of discovering oneself. So those two can work well together.
Beautiful. Yeah. And thinking contextually again about your choice to do the pilot study. When you think back to who you are in the world and that choice point of choosing to go on a pilot study without ever trying psychedelics,
Mhm.
what do you think of yourself?
Uh,
What kind of
well, I'm. I feel good about myself that I took the risk. And sometimes we take risks, and um, a whole hell of a lot comes up. And so I took a risk. I'm still alive. I think I'm better for it. It was a rough journey, and there's some really good things about it. There's some things that I wouldn't repeat about it, but it's I'm glad I took the risk versus never did and wondered what it would be like.
Well, if I can say so myself, I would definitely describe you as an extraordinarily courageous human being that loves to keep growing and learning. And there is no way you could have done that without courage.
Thank you. Appreciate it.
Absolutely, absolutely. And I'm wondering if you have clients in your practice that were talking to you about their desire to do a psychedelic assisted journey, whether it's through a trial, right, above ground versus
Mhm.
underground, what would you say to them?
Well, I would encourage them to explore it, and I would um, share some of my experience with it. And I think, everyone has their truth. And I think for me, I would want to know that they have the uh, support to both pre and post, since I wouldn't be doing it, since I'm not trained in psychedelics, in terms of uh, uh, that they have the support to go through the experience. Because in terms of, I think one of the things that needs to be looked at is how strong is the ego structure. What's the trauma involving, and what is the capacity of that person if they're going to do that, a journey or multiple journeys of really being able to hold that experience, integrate that experience over time, and ultimately heal.
I love the words you just use, ego structure and being able to integrate that journey over time.
Right.
Those two factors I think are huge, and I wish were talked about more in the community, right? Yeah, we obviously have some clinical rule outs, but we don't have enough conversation about what is the ego structure here and how much can it handle? How much cognitive flexibility do they have? But also how much spiritual flexibility. Because in my experience of folks that have done psychedelic journeys, including myself, sometimes what we experience spiritually is different than the context of how we have viewed ourselves as a spiritual being our whole life. So, for
Right.
example, if someone has been a Buddhist their whole life, they might see images of a Christian God, and
Hmm.
vice versa. Someone who's been Christian their whole life
Right.
might see, some indigenous folks and some Egyptian healers
Right.
and so that takes some spiritual flexibility as well.
Absolutely. Absolutely. I mean, it's what gets presented is it's um, it, it's unknown. So it's really can be a very expansive experience.
Yes, absolutely. And and when you said integration throughout time or over time, right? That is complicated. If we get into the realm of cost, right? And some people want to do these things for a quick fix. So I know I like to have conversations with my clients that there's no quick fix or, magic pill that in one session or two sessions you're suddenly going to be cured. So what is your built-in support network for after these dosage sessions? And what if someone can't afford traditional therapy? You know? So what would you
Yeah.
say?
Yeah, I would probably err on the side of caution because this is a very profound, deep experience,
Mhm.
potentially, depending upon what you're using and the doses and what is the environment it's being done under. So um, I would caution people to not underestimate what can be brought up, and it's a very powerful passage, and I think it's important that people have a skilled um, either clinician or guide that really understands both the psychological piece of it as well as the psychedelic piece of it, as well as the I think brain and physiological piece of it.
So important. Absolutely. And thank you for speaking to that too. Your
Right,
somatic experience in the biology of it all. Yes.
right, yeah.
Yeah. Yeah. Okay, so in just our last couple of minutes here, Tom, is there any overarching themes that you would like to reflect on with your own experience of what you've had or what you feel is really important for others to consider?
Let me think. Uh, I think it's a exciting field that has the potential to help a lot of people in very deep ways that we haven't had access to. So I would hope in the field that just this continual kind of learning is really encouraged, and as I things are kind of, what do you call it? Is it the FDA that's
Yes.
yes, as the FDA is allowing this, that um, uh, that there really is, we question, like, uh, how to best go about doing this, because we live in a society that people do want quick fixes. People now come to therapy, and a lot of people don't want to feel too deeply. They want to repair things. Obviously, some people do come for deep trauma work over a period of time, but a lot of people, we live in a society that people want quick answers, and I think people could have a powerful experience quickly, but if it's not really digested or integrated, I'm not sure what the value ultimately, if from the point of view of helping people experience their deepest selves.
Beautiful. So digestion and integration.
Right,
Yeah, without that, exactly. What is the point?
right.
Yeah. And if you don't mind, if you could just spend a minute because this is very rare that you are trained in all of these trauma modalities and have tried psychedelic experience. So if you could compare psychedelic assisted therapy to brain spotting, psychedelic assisted therapy to EMDR, and then to somatic experiencing, and then to IFS, what would you say the parallels or differences are?
Wow, that's a really interesting question. Um, the parallels are they all can lead to healing. There's different approaches. So brain spotting is that you're really just allowing your experience to evolve from the lower parts of your brain, like the brain stem and the limbic brain. Where in EMDR, you're really targeting certain distressing experiences or memories and going through they're very different approaches, and they lead to integration over time. And same thing with internal family systems. And the somatic experiencing is also, it really helps. It's helped me for myself, and has also worked with clients, is really helping people with regulating their parasympathetic and sympathetic nervous systems and staying within a window of tolerance. So the thing about psychedelics is this, like, or at least with psilocybin, I don't know about the other psychedelics because I don't have the experience with it. Is that it's just, you're not going to have those parameters.
Yeah.
It's going to do what it's going to do. So I think that's where you have to really be thoughtful in terms of what you want out of it, what's realistic out of it, and what you're potentially prepared for, and what how would you feel if you had a dark experience.
Yeah.
I think you, and I think there has been, I know with John Hopkins research in psychedelics, I think there were a lot of people who had really powerful positive experiences, but I think there needs to be more discussion of the dark journey
Yes,
and
absolutely.
how to work with the dark journey, because it was at times it was a dark journey for me.
Yeah,
And
absolutely, Tom. Thank you for saying that. Absolutely. Which is why it's so important that you were interviewed to talk about how it was both. It was very much a dark journey for you, but also you reaped so many rewards from doing it as well.
Right. Yeah.
Yeah, absolutely.
I really enjoyed having this discussion with you, and um, really wish you the best for this podcast. And I hope it really benefits a lot of people, because I know that's your intent.
Thank you, Tom. It is my intent. I want these medicines to heal humanity, and so I want them to be used in a trauma-informed way.
We kept the mics on after the official episode ended. Here are a few clips from the continued conversation.
Well, what was helpful for me this morning was when I found the notes. So they were taking notes when I was, where's my notes? I'll actually show it to you. They were taking notes when they were sitting with me. Oh, here. And so reading the notes, there were more positive things. Like, we tend to kind of focus on what was negative, but there was more positive things about it. Under the right circumstances, I would do it again. I'm a little nervous about the impact on the subtle body. Like, I don't know what causes a subtle body to tear. Like, I felt like it was really, at least that's the way it was described to me by the Buddhist healer that I had.
Yeah.
But I was just, I was disorganized.
Yeah. What I like to view it through the lens, I don't know if you've ever read The Psychedelic Experience, the book by Metzger and Leary, because they compare the psychedelic experience with the Bardo states. And the subtle body, by the way, and psilocybin is considered the worst medicine for, it's not pleasurable. It can be for some people, right? But psilocybin causes traumas to come up, and it can be really dark and shadowy for sure. But all psychedelics have us get in touch with our subtle body. And if we don't come back into our physical body at that moment of coming back in, then we can feel kind of stuck in one of the bardos. That's how I like to describe it.
Well, it seems like there should be some sort of process or ritual for that to happen. So when you're at a research institution, they're not going to do a kind of a, well, I could be mistaken. Maybe they would do that, but there wasn't a process about subtle body. I wasn't articulating my experience about subtle body because I wasn't sure I wasn't aware of what was happening. It was just a very intense experience.
Yeah. Yeah.
So,
Tom, all of this is really important to keep in the podcast. So I'll cut out our few minutes we were casual and bring this back in, because this is really important that the subtle body is talked about. And thank goodness you're a Buddhist practitioner. So you had resource.
right.
You had a Buddhist practitioner to go to, you had a teacher to go talk to, and that you even knew what subtle body was, so that after your experience, you could put it in that frame of reference.
Right. Yeah. So it's like, I wonder if somebody is highly sensitive or highly empathic, or is not even aware that they have a subtle body. Like, how do you understand that? How do you work with that? Does that somehow incomplete the process for people?
Well, in an ideal world, people wouldn't start with psilocybin. They'd start with ketamine and then do some MDMA, and then they transition to psilocybin, right? Because ketamine is getting to know the subtle body in a pleasurable way for most people. Right. And then MDMA is heart expanding, right? Which could be subtle body too, before the psilocybin. So there's already like a felt sense,
right? Even
a procedural memory a little bit of like leaving one's own body. So you can come back into your body. Mm-hmm. And starting with psilocybin in such a high dose, I mean, my God, for anyone, that would just be too much.
Yeah. So I'm a lot wiser now, but it's like, what did I know? And
Courage.
You know,
Courage.
So courage, whatever. So, but it happened, and I got through it, and I'm still alive. So, but if I were to do it again, I mean, what I would advise to people is, if you don't have any psychedelic experience, take it in stages. Don't just do a big one-off. That's unless you've got that kind of constitution, I think it's going to be. It was, I would say, was one of the hardest days of my life.
Yeah,
those 2 days.
That's important to hear.
Right. Yeah.
Right. Yeah. And I'm so sorry for you, but it's such a relief for me to see you. Because even like it was 9 months ago, I think we had lunch, and
Right.
you were still really, really affected by it. And you seem much more integrated now overall.
Yeah. Thank you. I appreciate it. Really wonderful to see you. There's a lot of light coming out of your eyes, by the way.
That's because I have these lights pointing at me.
No, there's a lot of inner light coming out of you.
Well, it takes light in one to see the light in another.
Thank you for listening to Trauma, Psychedelics, and Buddhism with Karen Sprinkle. If you enjoyed this episode, be sure to like, subscribe, and share. To learn more or to grab your copy of The Thriving Self, visit karensprinkle.com. Karen and this podcast do not endorse or encourage the illegal use of psychedelics.